Welcome. Today's seminar will start in just a minute. Let's give everyone a chance to get signed in, and then we'll kick off the webinar. Well, it's 12:01, and we want to welcome you and thank you for joining our HCG webinar series today. I'm Ferris Taylor, the Executive Director of the Healthcare Executive Group. Today's webinar is part of our ongoing series of webinars. Today's is by Hinge Health, one of our HCG newest and leading edge digital technology partners, and it's on Towards Next Generation Care, the Digital Musculoskeletal or MSK Clinic. And with COVID-19, this discussion could not be more timely or relevant. Many are working from home. Consumers are deferring critical care. COVID has changed most every aspect of healthcare and certainly has complicated musculoskeletal health, which we'll talk about. We're excited to have you with us today. And before starting, just a couple of housekeeping notes. All attendees will be on mute. So throughout the presentation, feel free to click the Q&A button on the right side of your panel to submit questions, and we'll make time at the end for Q&A. Second, we value your feedback, and we'll share a survey at the end of the webinar. We'd love to hear your thoughts. And finally, this webinar is being recorded, and you'll get a copy of the recording afterwards. Briefly as background, HCG is a national network of executives and industry thought leaders celebrating our 32nd year working together to improve and reshape healthcare. Our mission is guiding healthcare executives through innovation, change, and growth. And Hinge will certainly share a number of perspectives on innovation in this critical area today. Next slide, please. In fact, is 2 slides forward. Some background on HCG. HCG regularly interacts across multiple channels, such as this webinar series that we do monthly, national industry pulse research and reports, and other ways, as you can see on the slide. By facilitating these frequent interactions, which are all virtual at the moment, we provide a platform for networking, information sharing, and thought leadership. You can learn more about how we convene, network, and facilitate healthcare executives and our technology partners by going to hcg.org. Next slide. Throughout the year, our members discuss and debate critical challenges and opportunities in healthcare. We then, at the end of the year, formally vote and rank an HCG top 10 of a list of priorities for the coming year. Today's webinar will focus specifically on several of these 2020 HCG priorities. Number 2, as you see highlighted, consumer experience. Number 3, delivery system transformation. Number 6, holistic individual health. And of course, number 8, accessible points of care, including virtual care, all of which are high on executives' minds, especially with COVID-19. The Hinge Health team and their experience over many years in working with a variety of clients have become industry experts and digital health pioneers in the transition to more consumer-centric and technology-enabled programs for musculoskeletal health. I apologize for that, Dan. Next slide. Today we're joined by Daniel Perez, the CEO and co-founder of Hinge Health. With a long history of MSK injuries, including several leg surgeries, Dan has long been passionate about improving outcomes for musculoskeletal disorders. Originally from Miami, Dan pursued a PhD in medical sciences at the University of Oxford. So with that introduction, Dan, let me hand the presentation over to you.
Well, thanks so much, Ferris. I just wanted to also thank the Healthcare Executive Group. Obviously over 30 years, HCG has been providing a forum for healthcare executives to exchange ideas, opportunities, and we at Hinge were very grateful for this chance to share more about our story today. And just in interest of full disclosure, yes, started the PhD overseas, I did drop out to start Hinge Health, so obviously our parents are never happy about that, but certainly me and my co-founder, we both dropped out of our PhDs to found Hinge Health. We think we'll have a bigger impact on healthcare this way, by the way. But for today's agenda, I will firstly briefly review the challenges and trends with musculoskeletal conditions and how the fractured approach to MSK care is impacting members. Secondly, introduce you to how employers and health plans can implement next generation care by implementing a digital clinic strategy. And thirdly, share the latest data from the largest digital MSK study that came out with the authors out of Stanford, Vanderbilt, and UCSF. And finally, we'll conclude with some key takeaways. But with that, let's go ahead and let's dive in. So let's start with some key MSK challenges and trends that we're seeing in 2020 and beyond. So as many of you know, MSK conditions, they're very common, with more than 1 in 2 of members or adult Americans really impacted in any given year. With so many, adults or really members on your plan suffering from MSK conditions, it's no surprise that MSK is the top cost driver in 2020. It outpaced cancer, cardiovascular, and diabetes. This data is based on a recent survey from the Business Group on Health, where employers indicated their top medical cost drivers for 2019 and 2020 accelerated by COVID-19. Members, many of whom are suddenly working from home for the first time or had been rushed into shelter in place exposure, it's made virtual MSK care all the more imperative. And so as a result, what we're seeing is that employers and health plans, if we go to the next slide, are increasingly adopting virtual MSK solutions to support their members. And in fact, based on a recent survey, again, by the Business Group on Health on the nation's largest employers, overwhelmingly virtual MSK care will see the largest growth from 2020 through 2023. And this is based on the percentage change in respondents or employers considering virtual MSK care. So you could see a lot of care is being considered across the spectrum, not just MSK, but also derm and maternal health and, quite a bit around mental health, but MSK is far outpacing just about it or anything else that employers and health plans are considering. So if we move to the next slide, what we've seen is, with employers having made this rapid transition to remote work since shelter in place orders commenced in the spring, they're also, members are currently struggling with multiple challenges in this new normal. So we at Hinge Health, we recently conducted a survey of 900 plus US remote workers in June, so about 2 months ago. And we released a report called New Health Risks of the Remote Workplace. Now, our Hinge Health survey report revealed that the top 3 challenges here that you see on your screen are 1, social isolation and loneliness, which we could all appreciate. 2, the lack of movement. And 3, the difficulties in separating work and personal life. And obviously the lack of movement is very, very relevant to us. Many of your workers, or all of us really who transition to remote work, are likely struggling with all of these same challenges, and we didn't get a lot of chance to prep for working from home. And so with the next slide, it's no surprising that that lack of movement is one of the top challenges. Given that lack of movement is one of the top challenges, that back and joint pain has really shot up the list and is on the rise during COVID-19. So according to our Hinge Health survey report, more than 2 in 3 workers are now experiencing new or increased back and joint pain since working from home started during COVID. And I think a lot of us could relate to that, having sudden makeshift offices at home or working on the kitchen table. It's just different ergonomic setup than what we might have had in a more professional workplace. So with MSK conditions on the rise, as the next slide, what can employers and health plans do to address MSK more effectively? And a key challenge, however, with MSK care has been this fractured continuum, in that for members seeking care at MSK, they have to get care across many different providers, results in multiple handoffs. It makes it harder for employers and health plans as well as for members. And so to put these challenges into focus, we want to meet 2 members who have very different MSK challenges to show you just how fractured the care continuum could be for members with MSK conditions. So let's dive in. I'd like to first introduce to you Kevin. He's very young, he's only 37 years old, and has been working in a distribution center for 4 years. His job involves walking on concrete, moving a lot of parcels, so he receives periodic safety training, which is never very engaging. While Kevin's job already causes a lot of aches and pains, his back has been acting up since he injured it playing with his kids at home. He couldn't see a PT without missing work, which meant his injury festered and increased the strain his job placed on his back pain. Eventually, he stepped away at disability. Let's move on. And now I'd like to demonstrate just how varied challenges within MSK are and the need to have different solutions across the continuum. Here, let's meet Jane. So Jane is also very young. She's only 51 years old. She's in accounting and has been sheltering in place for the past 5 months. She's had chronic hip pain for 4 years, but it's really worsened, and the lack of activity has caused her to gain 20 pounds. So she recently visited a surgeon based on her sister's suggestion, who also had a surgery from that same surgeon several years ago, and he immediately recommended a hip replacement. So Jane, she's not sure of her options, as many of us might be in this situation, feeling anxious and uncomfortable about this decision. So what's notable about Jane and Kevin, if we go to the next slide, is that the fractured and very different trajectories of Kevin and Jane is very common within MSK. In fact, we'd argue at Hinge Health that these fractured pathways and disjointed capabilities are the biggest hurdles standing between employers and health plans solving their MSK challenges. Members often feel that no one person is championing their healthcare. Indeed, if Kevin's health plan or employer wanted a solution that could have helped him address his MSK pain before it became expensive, before he left the workforce, that employer would need no less than 4 different solutions. Ideally a preventative solution that's tailored to Kevin's job in a distribution center that would help him as well as his colleagues to avoid getting injured in the first place. Second, some kind of acute care program that would help him whenever he had a bad flare-up. He works in a warehouse, so no matter how good our safety record might be as a company, his position is a higher risk position and is going to cause some aches and pains. And moreover, ideally he'd have an option to do one-on-one virtual PT sessions in the evening or during his break. Now, Jane's case, given that she's a chronic MSK condition, it's even more complex than Kevin, actually. She would need 6 to 7 services, including a program specifically tailored to the behavioral complexity of chronic pain patients. Ideally, an expert medical opinion in case she is considering an elective surgery, so she could have her treatment options reviewed with her. And should she go on to surgery, some kind of a post-surgical rehab program. And so as you can see, it's just very diverse, the needs of members or patients with MSK conditions. And without even being a doctor, we could appreciate, somebody with a sprained ankle is very different than somebody with hip arthritis. And likewise, the 30-year-old with a sprained ankle being different from the 55-year-old with hip arthritis is going to be different from somebody who just had a knee replacement yesterday. And the needs for these people are very different. But right now, the solution set often for all of them is the same, particularly when it comes to digital health solutions. So we've really thought around that. So next slide. So what we've done at Hinge Health is think really deeply around this failure of delivery of care. We're not trying to reinvent a new type of care. We're simply trying to make it easier to get the care we know already works, and acknowledging that the care for different patients is going to be very different depending on the context. So to introduce our digital MSK clinic, we've for our next slide, to address this fragmented care continuum in MSK care, we created our digital clinic focused on MSK, and it's to serve as the one-stop shop for MSK needs, from prevention to acute to chronic to surgery, and even expert medical opinions. So let me walk you through each of these. So firstly, our prevention program is created with a goal of addressing patients before they become expensive. It's actually free. It's a program we offer free to all of our customers, and it will cover about 9 in 10 job types in America. Secondly, our acute program provides care to patients who have periodic injuries, covers all muscle groups, all joint areas, includes anytime one-on-one virtual PT. And our third program is for chronic musculoskeletal conditions. As many of you already know, chronic MSK spend is driven by procedures that are often elective, and they're driving the majority of costs. In fact, $3 and $4 in MSK are spent for patients with a chronic musculoskeletal condition, and that's similar across other indications. About $3 and $4 on cardiovascular are spent on those with chronic cardiovascular conditions. And while our chronic program does help avoid most surgeries, about 2 in 3, we understand that some people do need surgery. For some patients that is indicated, and we have a surgery rehab program that optimizes a member's rehab before surgery to maximize their outcomes, ensure they can return to work. And lastly, we, for all of this, we bundle an expert medical opinion service so that all members could have access to specialists' opinion if they're considering an invasive elective procedure. So by combining these digital care pathways in our expert medical opinion service, our digital MSK clinic is seeking to address the full continuum of care, really meeting members where they are and addressing that top cost driver, which is MSK. So as our next slide, so while our clinic spans a continuum of care, as I mentioned to you earlier, the majority of spend is on chronic musculoskeletal conditions. So as a result, treating chronic MSK really holds the highest ROI potential for health plans and employers. And as the biggest driver of MSK spend, we're gonna focus on this for the rest of this discussion, chronic MSK pain, and as well as our outcomes as well. So let's dig in. So I think the first thing to understand about chronic musculoskeletal pain is that it's actually both physical and mental. It's a very complex interplay. This surprises people often when we think about back or joint pain. So, but it's important to know chronic pain is just simply not a manifesting a physical injury. It's not simply a physical injury or a lack of movement. Weight also plays a role. In fact, 1 in 2 people who are overweight experiences some kind of MSK pain. Mental health conditions like anxiety, depression, not just impact our perception of our chronic pain, it impacts our reaction to any sort of intervention as well, and it can blunt any sort of intervention that we're doing for chronic MSK pain. And oftentimes, when chronic MSK pain is treated in isolation of depression, or depression is treated in isolation of the chronic MSK pain, neither improves until we address them both. And people with chronic musculoskeletal pain have about double the risk of suicide than those without. So, these are very serious mental and physical well-being issues that we think quite deeply about at Hinge, and they really have to be addressed to be able to get to the root cause of what's causing the MSK pain. And overall, we could all probably appreciate how pain would impact our mood. If you have back pain and you can't sleep, for instance, because you can't find a comfortable place, that's even a couple of days, it's going to have a significant impact on your mood. And if this is stretching on for years, where you're constantly having back pain, you could see how that could lead to an actually overt chronic mood disorder. So as a next slide, so given the complexity of chronic pain, we've thought a lot, how can we treat it effectively? Just prescribing physical therapy or surgery will not likely solve the problem. It could be actually exceptionally expensive, the latter. So leading medical bodies indicate that a biopsychosocial approach is the gold standard for treating chronic MSK pain. So, what is the biopsychosocial approach? It's quite simply, it focuses on the biology or the physiology underlying our body's health. For instance, we know that exercise therapy can reduce your pain, if we could just move your joint by 50, 60+%. We also know that weight loss, for those who are obese, has a very big impact on MSK outcomes, not just because of the load on your joint. If you can imagine knee arthritis, hip arthritis are going to be aggravated by increased load on their joints, but in fact, it even impacts outcomes for non-load bearing joints, such as your hands and wrists and such, because of the increased inflammation that happens in the setting of obesity. Now, the psychological component of the biopsychosocial approach focuses on the psychology of thoughts, feelings, behaviors influencing health. For example, research shows that a high belief in a can-do attitude can lead to lower pain levels even at 1 to 2 years post-intervention. And finally, the social component focuses on how society and culture can influence how people view their health. In this way, we really put a lot of thought into our patient education and how we could help adjust thoughts, how we could help people adjust their conceptions around MSK. A lot of folks think, my knee hurts, I shouldn't move it, or back pain is just part of getting old. And we work really hard to adjust their perceptions of their pain and what they think is true, and challenge some of those misconceptions quite heavily. So building on that in the next slide, to provide behavioral intervention that members with chronic MSK conditions need, our clinical care model surrounds members with a complete care team. So, and that this team incorporates lifestyle factors, behavior change, and mental health screening in addition to movement. So first of all, our approach with our digital MSK clinic is to ensure that every participant has anytime access to our physical therapist who design their exercise regime, review their clinical screener, and monitor and intervene based on their clinical outcomes. But secondly, our health coaches are on the front line, and probably the biggest predictor to outcome improvement for somebody with a chronic MSK condition is adherence to the care plan. And that's the job of our health coaches. They are here to help spur adherence. And that's their job. That's what they're trained in, is motivational interviewing. We know that these conditions are relatively medically simple, but they're behaviorally very complex. And how could we get someone to do something they simply don't want to do, which is to move a painful joint? And that can be quite tricky. But we know if they move it over time, the pain is reducing. And of course, we on top of our coaches and physical therapists, we have our sensor technology, our wearable sensor technology that supports members in a clinical team by providing real-time feedback and tracking, so it's easy to do your exercise therapy right from home. So as a quick summary of our clinical care model, it's obviously specialist clinicians designing the program, specific healthcare coaches whose role is ensuring adherence, and lastly is our technology to enable at-home care. So we have a quick demo video. Let's see if we could get this to work to really demonstrate our overall program.
Here's Steve. He's taking part in the Hinge Health program for back pain and is using his motion sensors to guide him through some therapeutic exercises. In his first exercise, the app guides Steve into a side bend. He moves his body into the green target zone and holds the position for the suggested amount of time. The wearable sensors guide members with real-time feedback, so they're confident at each step, while the app tracks if members have been doing their exercises to help keep them accountable. Steve's next exercise is a woodpecker stretch. As he completes the exercises, both he and his health coach can see his progress over time. Each session consists of therapeutic exercises and education to read, and it takes only 10 to 15 minutes. Over time, he'll unlock new exercises to continue to build his mobility and strength as he receives support from his health coach to achieve his goals. By committing to the program and reading his weekly educational articles, Steve has a better perception of how to manage his condition and sees a significant reduction in his pain so he can do the things he loves.
Great. Hope the audio worked out well. So next, I'd like to share the results from a recent chronic MSK study. It was conducted by researchers from Stanford, Vanderbilt, and University of California. It's a 10,000 patient cohort study. It was the largest ever done for a digital MSK intervention. So let's dig in. As a quick background, as mentioned, the study had just over 10,000 participants, about 10.2 thousand, and it was almost perfect gender distribution, about 50-50 each. And researchers conducting this study were seeking to understand, what factors predict program completion, and a large scale, what are the clinical outcomes of this digital MSK intervention on pain, mental health, surgery intent, and overall impact on financial outcomes. So as a quick overview of some of the outcomes that we achieved in the next slide. What we found were 3 to 4 participants remained active throughout the Hinge Health 12-week intensive care program. That's about 3x higher than the industry average. Again, underlining our emphasis on adherence by having a health coach involved as part of the care team. The attributes that actually predicted completion are older age and lower BMI. Now, lower BMI isn't that surprising to us. We know lower BMI correlates with lower pain levels as well. But older age was something that years ago it initially surprised us. We've consistently seen this in all of our data. And what we found is that as members get a bit older, mobility issues becomes more concerning to them. They might have an older sibling or a parent or a friend who they've seen have mobility issues as they've gone older. And so this becomes a key concern, particularly around independence. And so in retrospect, this isn't surprising to us anymore that older people engage better with our technology. And the study also looked at factors like gender, depression, anxiety, and baseline pain, and found that Hinge Health was able to equally engage participants across all these conditions to complete the program. So let's dig into some of the more specific results. So across this study, participants actually completed over 359,000 exercise therapy sessions, and it's equivalent of 4,800 Ironmans or so. So the scale of the data for this MSK solution is really unprecedented, but that's what clients should be looking for. It's something that's been proven over tens of thousands of hours, and each week the average participant completed about 3.3 exercise therapy sessions and approximately 2 education sessions. And we really want to emphasize just how important our education is to our program, because again, there's so many misconceptions. A lot of folks get jazzed up about our digital exercise therapy, but we think our patient education is just as important to achieving our outcomes. Now, the successful engagement is achieved because of this combination of virtual one-on-one PT and health coaches. In fact, we've probably over-invested a bit in our clinical support relative to anybody else. We probably have 10 times more clinical support because of just how important we found that to be in achieving our clinical outcomes. And as the next slide, when we look at the pain reduction, 4 out of 5 participants reported a meaningful improvement in pain. And on average, the average participant experienced a 69% reduction in their pain from baseline. And to put that in perspective, in clinical trials with opiates and morphine, the average pain reduction for chronic pain is usually around 15%. And this means our members were achieving about a more than 4x better outcome improvement for pain relative to opiates without the other side effects and sequelae that come along with taking opiates. Importantly as well, in our next slide, we were able to show a dose dependence between actually using our product, using our digital intervention, and outcome improvement. Now, you might think, well, duh, that's what we would expect. This is actually, it should be table stakes, but not all digital health interventions have shown this. In fact, many have shown 0 correlation between actually using the app and using the product and outcome improvement. Particularly for pain, it could be no more than a placebo effect. And so it's really important for clinicians, employers, health plans to really ask that question. What is the correlation between actually using your product and outcome improvement? And what we've shown is that the more exercise therapy sessions people did with our product, the better they got. What we also found was that our coach interactions, the more they interact with their coach, at least through their first 20 sessions, directly correlated with pain reduction. And of course, that was because the coach interactions led to an increased adherence. And if we go to the next slide, we also had a significant impact on mental health outcomes. If you're improving MSK, if you're genuinely improving MSK outcomes, you should have a concomitant impact on mental health outcomes. So at the start of the program, we screened for depression and anxiety at baseline, so week 0, using the PHQ-9 and GAD-7 survey. And we found that Hinge participants had just under a 60% reduction in each of these outcome measures pre-post. And again, chronic MSK pain and depression are very closely related because they share the similar neural pathways in the brain. As a result, Hinge Health's holistic approach really does address both mental health and chronic MSK pain together. And if we keep going, I know we're zooming right through, we also really think through what is the financial impact we can have as we think about our overall triple aim goals of improving outcomes, improving satisfaction and experience, but also reducing costs in the system. So we know a lot of MSK costs are driven by chronic MSK conditions, and they are driven by elective surgeries. These aren't emergency surgeries. And so we ask participants how likely are they to have surgery in the next year. Interestingly, knee participants in this study had a much higher baseline interest in surgery than back pain participants, and we've seen that consistent across our book of business. At the end of our initial 12-week intervention and reassessed at 12 months, you see very consistent reduction in surgery interest or pursuit of elective surgery, about 2 and 3. And this avoidance and expensive surgeries is what really drives down the cost of MSK spend, because overall musculoskeletal is about 1/6 of the healthcare costs, and 50 to 60% of MSK costs is driven by surgery. So reducing MSK orthopedic costs is very synonymous with how to reduce surgery spend. And so in our study of the 10,000 participants, we saw an average about $5,012 saved per participant per year, overwhelmingly driven by reduced surgery utilization. So these outcomes are very consistent on our next slide with what we've seen in our book of business across other studies. So we've done, obviously this most recent study was published in conjunction with Stanford, Vanderbilt, and UCSF. We've also published a medical claims analysis, several medical claims analyses now, which you would download from our website, showing Hinge Health is directly correlated with MSK spend reduction. As we reduce both their pain And once you reduce somebody's pain, they're obviously much less likely to pursue an elective surgery for that pain if it's no longer existing. And what we've also been able to show is that for about every percentage point reduction in pain across the population, we're saving about $71.09 per participant. And so we've been able to directly correlate pain reduction with dollars saved. So, and in the next slide, you know, we share a lot of numbers over the course of this presentation, but behind the numbers, it's always heartwarming to hear the stories from real people on how Hinge Health has improved their lives. And I think, you know, we have videos of several of our participants on our website who wanted to share their story. But Margaret and Gary shared stories of how their pain is reduced to the point where they didn't need pain meds or surgery anymore. And VP, she speaks to the mental health and physical transformation she experienced after the Hinge Health program helped her reduce her chronic pain. And we hear that a lot from participants. We probably get 30 to 40 plus testimonials every day from participants into Hinge Health, and several of our customers talk about it as well. And it's quite heartwarming because it's not just that we're helping people's pain, is that we're helping them get back to, you know, going for a walk with their wife or playing tennis with their husband or, you know, horsing around with their kids again. These are the life activities that people are missing out on because of chronic MSK pain. And so let's keep going. So with that, I'd like to thank everybody for joining us. I know I covered a lot. I spewed a lot of numbers at those at everybody. So just wanted to review some very, very quick takeaways. First, with MSK on the rise due to remote, or MSK challenges on the rise due to remote work, virtual MSK care is poised to grow, you know, more than any other area in virtual care between 2020 and 2023. A key challenge, however, is the fractured approach to musculoskeletal care. It's involved multiple providers and handoffs for members in health plans. It leaves members feeling as if no one is really championing their healthcare. And as mentioned earlier, leading medical bodies have demonstrated that a biopsychosocial approach to chronic MSK care that holistically addresses behavioral, lifestyle, mental health, as well as physical therapy is more effective than any in isolation. And finally, you know, when thinking about an MSK solution, really think about, you know, what sort of outcomes have they been able to demonstrate? And I'd push back a bit on the outcomes and ask some detailed questions. And ideally, you could be more confident in solutions that have already been vetted extensively by other health plans and other leading employers who have similarly rigorous buying processes. And you could often rely on that, knowing that they've already done significant diligence on the market leader. So with that, I wanted to, I think, turn it back over to Ferris.
Dan, thank you. I'm blown away. And I even picked up a new vocabulary. Biopsychosocial probably applies in a lot of ways, but I hadn't applied it to MSK. So this has really been terrific. And as a reminder to our participants, please type your questions into the question box in your control panel, and we will get to them. While we're sorting through the questions, if you'd like to set up a meeting with the Hinge Health team or speak to someone to learn more about Hinge Health's new digital MSK clinic, you can text 669-244-4675, and we'll put that into the chat box so that you can see it. But they'll be glad to get you connected. So Dan, we do have some questions coming in, and we have some ample time to address them. Ali is asking, what is the role of the physical therapist, and contrasting that, what's the role of the coach, and who does the member speak to first, PT or health coach? How does that all come together?
Great question, and thanks for that question. So at a product level, our PTs design each of our digital care programs, and then obviously, as you see on the screen, we have multiple buckets or multiple areas of care that a member could interact with depending on where they are in their MSK journey. So prevention is software only mediated. It's designed by our physical therapists. It's self-serve. It's for people who don't have a live MSK condition, but are at risk, and it's free for our entire customer base, by the way. All of our customers get full access to a prevention solution for their entire member base. For acute, so thinking about somebody with a sprained ankle, twisted knee, our physical therapists lead the entire member interaction. There is no health coach for acute because acute MSK conditions aren't often behaviorally complex. A lot of them self-resolve in a few weeks. Now, chronic MSK conditions are behaviorally complex. So after enrollment, each participant gets a personalized program that has been designed by our physical therapist and is assigned a dedicated PT and a dedicated health coach. The PT will introduce the member to their care team and provides clinical support through the program, including virtual PT sessions as needed. And the health coach provides, health education, and particularly helps the member integrate the program into their daily life, helping them keep accountable. For our surgery program, similar to chronic, each participant gets a personalized exercise program designed by our PTs and works with a dedicated PT and a dedicated health coach who is providing the health education and helping spur engagement with our sensor-guided technology for exercise therapy. Additionally, their dedicated PT reviews the care plan and shares that care plan with the participant's surgeon. And of course, if the surgeon has final say on the care plan that the physical therapist shares with them. And so just a quick summarize for our acute program, the PT leads the whole interaction. For chronic and surgery, our PT works in conjunction with our health coach, but the PT is upfront designing the program and the health coach is there to help spur and ensure adherence after that care plan has been set.
And it sounds like they're coordinated. They're interfacing with each other as well. So it's that combination that is most impactful. Thank you, Dan. Another question. You had mentioned working from home is increasing joint pain, likely due to poor setup and improper chairs and things like that. Do you offer ergonomic assessments?
That's a great question. Yes, in Hinge Health, we offer ergonomic assessments as part of our acute, chronic, and surgery programs. Our PTs are happy to do a virtual video visit to assess a member's personal work environment, provide strategies for improvement. We don't provide on-site ergonomic evaluations, however, or provide any equipment.
Given COVID, on-site is not gonna take place there. A number of questions coming in, and we have ample time, so keep them coming. Michael asks, how does your expert medical opinion, which I see there on the slide, work? How does that function?
Sure. So our expert medical opinion, or EMO, is focused on common elective chronic MSK procedures. So our perspective on expert medical opinion today is a product class, and I'm not sure how many reviewers are aware of the product class. It often has very low utilization within a member base, yet employers and health plans are often paying a PM fee for that. So they're paying for their entire population, despite the fact that utilization can be very low. So first of all, we've approached it differently in that we've made our expert medical opinion service for free across our entire customer base to remove that sort of economic disincentive of people of charging for something that people aren't using extensively. Obviously, we want to drive much higher adherence anyways, and we are focused on elective chronic MSK procedures. What we've also found, along with the low utilization of baseline of most EMO services, is that secondly, most ROI is driven by MSK for EMO. Overwhelmingly, expert medical opinions ROI is driven by helping members avoid elective MSK procedures. So we're going to focus on elective MSK procedures. If a member begins this process either directly by self-referring themselves to our EMO or being referred by another Hinge Health clinician because they're involved, say, in our chronic program and are at risk still for surgery, we will collect their relevant medical records, including their imaging, and have one of our expert physicians review the files. Our doctors will then speak directly with the participant and share the report with the participant and their provider. And of course, the participant will have final say on, what they would like to do for their care.
Terrific. And as you were answering that, the follow-up question came in. You started to touch on this, but maybe just to clarify, how is your EMO different from other EMOs or second opinion services? And there are a lot of them out there.
That's a great question. So I think the key difference is, first of all, we will be using our own in-house doctors and nationally recognized orthopedic specialists to conduct our EMOs. We recognize that, most most conditions for elective MSK procedures are actually relatively bread and butter: knee replacements, hip replacements, spinal fusions, some arthroscopies. And so our in-house specialists will be able to handle the overwhelming majority, which allows us to give it away for free. And then, of course, for some of the more niche conditions, we'll reach out to our network. We also increase appropriate utilization of EMO before elective MSK surgeries in several ways. One, we're able to leverage our relationship with the participant. Our clinical team, our PTs and coaches, they build great relationships with our participants. They're in touch 4 to 6 times per week, and the member is giving us that access to them. But on top of that, we're also, secondly, the member is giving us their outcomes data. So we collect very rich outcome data for each participant, pain levels multiple times a week. The members overtly tells us at baseline and multiple times throughout the program their overt interest in pursuing an elective surgery, such that we could better target our services. As an example, somebody on a chronic program who's at risk for, knee arthroscopy or knee replacement, we know their pain at baseline. We know their overt interest in surgery. If 5, 6, 10 weeks in, their pain is not improving, and in fact their interest in pursuing an elective surgery for their knee pain is increasing, we could then proactively reach out to that member and introduce them to our expert medical opinion service, and to see if this is something they'd like to participate in. And again, it's no cost for the member and no cost to the plan. We're just trying to make sure that we help the member exhaust all non-surgical approaches before going under the knife.
Terrific. And I'll interject here. There's you've mentioned it. There's several questions that have come in terms of the pricing model, the business model for new MSK clinic, and is it PPM, fee for service? There's another question very similar, how much do you charge? You may not want to answer that. Is it on a per member, per employee, per month? Does the patient pay a copay? A whole bunch of questions around pricing. Do you want to take those on?
Absolutely, absolutely. So here we got this slide showing this. So in terms of our pricing, anything that's charged is always on a utilization basis. We do not charge PEPM. We don't like PEPM. So if nobody uses it, nobody gets charged. So why don't we walk through each capability that you see on the screen. So prevention, first of all, is free. Everybody has full access to a prevention program. All members, for our customers, their full population, workers, including members on the plan who might be at home, spouses, they have full access to a prevention program. And again, it covers 9 and 10 job types, including people who might be working from home. We cover that. Now, our acute program is $250 per participant for unlimited access for the full year. So for example, if you sprain your ankle in February and you need, you're hiking with your kids and you severely sprain your ankle and you need a couple of virtual one-on-one PT sessions, that'll incur $250 charge, but it covers you for a full 365 days. So for instance, if you sprain your ankle in February, but then you twist your knee in June, there's no additional charge. If you need to see a PT again in June and you hurt your shoulder in November, you have as many episodes as, for that full 365 days. And that's very different from others, how they price their acute program on a per episode basis, which means 3 injuries could each, and they're usually around $600 per episode. Each injury could, 3 injuries a year, that's $1,800 for virtual PT. Ours would be capped at $250. Our chronic and our surgery programs are both $995, and it again covers 12 months of unlimited access to our virtual PT, unlimited access to our health coaches, or as much access to PT as they need, and unlimited access to our health coaches. Includes sensor technology, tablets, so the full hardware suite to get them started. Notably, if they start our chronic program, because nobody gets charged more than our $995 cap per year. If they start our chronic program and incur a charge, and we can't prevent the surgery, they continue to go into surgery, we do not charge for our post-operative rehab. We won't charge for both. So we will never charge more than $995 in a given year per participant. Same goes with acute. If they do acute in February and it incurs a $250 charge, then do our chronic knee program in June. The chronic program wouldn't be charged at $995. It would actually be charged at $745 because the $250 from acute would apply to chronic. So we try to be really simple. Everything is capped at $995, and they are counted towards each other if somebody does multiple pathways.
And from your experience, no co-pays on the part of typically this is the plan or the.
Oh, that's a great question. So we are first dollar eligible because we are a disease management program. We're considered a disease management or an EAP program because we're limited in scope, duration, and amount. And so for all of these for these conditions, we are eligible for first dollar coverage, and we have 5 million members who have access to Hinge Health, and all of them have access to Hinge Health on a first dollar basis, such that there is no deductible, no copay, and we find we really don't want any barrier between the member accessing care or going to surgery, because oftentimes the surgery seems like an easy choice. We want to reduce that barrier as much as possible, because really the economic incentive is on the part of the plan and the employer to avoid that $100,000 back surgery, the $50,000 knee replacement. And we give a guaranteed ROI. We will guarantee 100% of our fees at risk for ROI because we're so confident that we will reduce surgery utilization.
Wow. Dan, I've been in healthcare for 30 years, and you've got a business model and you've got a pricing model that goes with it. And sort of aligned with that, a question has come in, and this is a health plan. My strategic roadmap is pretty full at this point. Why should I prioritize MSK over other initiatives?
That's a great question. And so I'd say MSK is growing more than other cost buckets. For if you're a health plan that's talking to self-insured employers, put all of your employer logos on your wall and throw a dart at any one of them. MSK is a top 3 concern, if not the #1 concern for all of your customers. And so this is something your customers care about and is top of mind for your customers. And at the end user level, whether you're working in a health plan and thinking about a fully insured book, or you're at a health plan thinking about a self-insured book, the person at the far extreme of that is the patient, is the member. And most members right now, as we saw in our study, over 70% of them are having increased challenges with back and joint pain since COVID started, and there's a significant concern with going in to see an in-person physical therapist given social distancing. So I'd say any sort of health plan or employer, why it should be prioritized. It is a big cost driver and it's growing faster than anything else. It's top of mind for your members and it's only getting worse. And if you're a health plan thinking about the customers, it's certainly top of mind for basically every employer out there. And to put in perspective, Hinge Health, we've more than quintupled our customer base in the past 14 months, just to demonstrate the eagerness from our customer base to adopt, and our new customer base to adopt digital MSK solutions.
I can relate to everything that you're saying, Dan. I think yesterday morning I was at my desk at 8 o'clock in the morning. My wife bought me a sandwich, and about 11 o'clock last night we finished up, and I could hardly move. And I'm in pretty good physical shape. I had mentioned to you that 15 years ago I was all the way to back surgery with a neurologist, and it scared me. And without Hinge Health, I was able to back away from that, but it was on my own, and it was PT, not a health coach. I could have used that part of it as well. So thank you so much for sharing that. A couple other questions that have come in here, and you had mentioned it, and I wrote down because last year one of the top 10 for HCG was the opioid crisis. Did I hear you right where you said that this is 4 times better than an opioid? How do you think MSK is related to the opioid epidemic that we're facing right now as a country or a world?
And so, first of all, when it comes to opiates for chronic MSK, there is basically no data that shows opiates work in this, beyond 3 to 4, should be prescribed beyond 3 to 4 days, and certainly not for chronic musculoskeletal conditions. In a peri-surgical setting, fine, opiates make sense and very limited use, but there is very little data to show that they should be used beyond a couple of days, and yet they've been increasingly used, consistently used, I should say, in the setting of chronic MSK conditions. And what the data shows that opiate treatment for chronic MSK conditions could lead to around a 15% reduction in pain, but focusing on what we've shown is well over 60, if not 70% reduction in pain for going through our program, and obviously without the side effects, not just respiratory and GI, but sociological life effects for somebody who is on opiates long term and addiction. Now, how does MSK impact the opiate epidemic? So I would say that I'm not an expert on the opiate epidemic overall. It's a complex issue that has more to do with just chronic pain and MSK and more socioeconomic issues that are happening in America right now that are leading to an increased use of opiates. But does chronic pain put you at increased risk? Absolutely. People from dental surgery and orthopedic surgeries are some at the highest risk for being introduced to opiates. But what we're also seeing is that sometimes they're just, misprescribed. We have members on our program who tell us, hey, my wife had knee replacement last year and went home with a 30-day or 90-day supply of opiates. And she used 4 or 5 days worth, and the other 85 days have been sitting in her medicine cabinet for the past year and a half for her teenage son to potentially have access to. And we're seeing that increasingly as well, and that, it's not just the member who has surgery or elective surgery who gets prescribed opiates who is now at risk, but everybody in their family is potentially at risk now as well. If they're coming home with a 90-day supply of opiates, even if they take half of it, there's another 40 pills, or if it's twice a day, 80 pills sitting in that medicine cabinet. That's still good for a couple of years, and oftentimes people don't throw them away. And so that's also playing a role. And then from there, addiction's a slippery slope, and what happens from there. So what we have shown, and we actually have more medical claims analyses than RX claims analyses, but in several RX claims, what we're showing an actually overt decrease in number of opiate scripts. Now, cost savings isn't as much. Opiates aren't that expensive, unfortunately. But what we showed, it was with a hospitality resort, was about an 18% overall reduction in opiate scripts for their population overall, and a significant reduction to almost nothing for those who are doing our program.
Terrific. And I think in some ways, especially knee surgery, and I relate back to your charts on back pain versus knee surgeries, but they become almost routine. But with it comes an opioid prescription most usually, and certainly has facilitated part of the crisis that we're addressing. If that 30-day supply or the portion of the 30-day supply is in the cabinet in the bathroom, home invasions, robberies, and like that, it's a crisis. There's a question here, and Dan, this may be one that it's more technical. You may want to follow up one-on-one. So if it's not a discussion here, but the question really is, back to your research, how do you validate the reductions in surgery? Intent is just one way of doing that, and if that's a technical question. So if you don't want to answer it, that's fine.
I think it's a great question, and I appreciate you asking it. Absolutely should be validated, and that's what we've done. We actually have, and if anybody's interested, you can email me, dan@hingehealth.com, and we can share with you some of our research. We've actually published multiple claims analyses. We published the most recent 3-year claims analyses with an employer. So looking at the year before Hinge Health, looking at the Hinge Health intervention, and then looking at the year after Hinge Health to actually demonstrate that it's not just a reduction in surgery intent, but a dollar for dollar reduction in MSK costs. And for this employer, this 30,000 life group, what we found was the 2 years leading up to Hinge, in fact, the 5 years leading up to Hinge, MSK costs were increasing between 6 to 8% per year. And they would have anticipated another 6% increase the next year. We showed an overt $1.3 million decrease in MSK spend for this employer. Like their MSK costs literally between 2018 and 2019 went down year over year. Now, importantly, we were only addressing knee and back for this particular employer. They wanted to focus on knee and back. And when we looked at the spend, knee and back costs were the ones who went down. All other MSK costs continue to go up, hip, shoulder, neck, continue to go up in that 3-year period by 28%. But knee and back costs, we compared 2017, 2018, and 2019. We brought the 2019 costs all the way down to, if not below, right around the 2017 levels. And so instead of increasing, it actually decreased well below even 2018. And so we could share those analyses. But the issue with MSK is that, the fruit is hanging relatively low because so much of the cost is driven by dubious elective procedures. And if you improve somebody's pain, they're not going to be pursuing, or they're going to be much less likely to pursue those elective procedures. And very happy to share with any audience members some of the data around these elective MSK procedures. If anybody's still listening, you could Google, let me see, it was a New York Times article years ago around surgery, which I'll share with you. So you can see they actually had a great summary around the medical.
In the follow-up. We can put the link of that into the follow-up, Dan. That would be excellent. And just as a reminder, you can text 669-244-4675. And if you want to speak to Dan on this, just put that in the text and we will get back to you.
Yeah.
Go ahead.
You could Google New York Times useless surgery, and they have a great article on why useless surgery is still popular. It's from a couple years ago, but I always share this with employers and non-doctors. They summarize all the clinical research relatively well and link to the original research articles, but they put it into layman's terms. And so it's a pretty good summary of, just how intellectually dishonest a lot of orthopedics has been over the years, and it's led to significant costs for the system, but also poor outcomes for patients.
Excellent. Well, thank you, Dan. And I know we're coming up to the top of the hour. We want to thank everyone that's been on and participated in the clinic today. I think I can speak for everyone, Dan, that we've learned a lot, and with so many of us working from home and avoiding in-person services and limiting our COVID exposure, the handheld approach couldn't be more timely. We appreciate the clinic sharing the advancements that you've made in making care and treatment of musculoskeletal pain more convenient for the consumer, and not just less costly, but more convenient. So especially in the middle of this COVID crisis, it's really important. There's much that payers and providers and employers can do in collaborating to adopt digital health solutions such as these. So we hope each of the listeners will apply some of these tools and this interest in Hinge Health to their business. In closing, next slide, I want to encourage each of you to watch next Monday for the release of our COVID flash survey results. The HCAG Top 10 priorities for 2020 were released in January, and in March they all changed. And we've updated that research to show how those priorities have changed. I mentioned that, as a tidbit, the consumer experience has gone to the top of the list, and also that accessible points of care, really remote care like Hinge is promoting, has gone to the top of the list. As the next slide, you can start weighing in on what will become the HCG Top 10 for 2021 by going to bit.ly 2020-top-10. So that's bit.ly/2020-top-10. And you may also have interest in seeing how these top 20 priorities have changed over the last 10 years. You can find all of those and an analysis of how each of these things have come to the top of the healthcare priority list over the last 10 years. So next slide, in closing, we thank all of you for attending. We invite you to join in our ongoing discussions throughout the year via LinkedIn, YouTube, Twitter. Those are in this last slide, and our biweekly newsletter, one going out today or tomorrow. You can register for all of those on our website. Finally, special thanks, Dan, to you and Hinge Health, first of all, for your sponsorship of HCG, which is an annual relationship, and we're going to do more of these types of sessions, and also for taking us through this revolutionary approach to MSK Health. Thanks again to each of you. Stay safe, be well, and have a great day.
Thank you so much, Ferris, and thank you, HCEG, for the opportunity.
Thanks.